Hey guys, it's Dr. Emer. I'm going really slow on my patient today with darker skin who has acne scars, and we're using the Fraxel 1550 to help improve the scars. She's had some ice pick scar treatments with TCA Cross and microneedling radiofrequency with some improvement, but because some of the scars are still more noticeable, I decided to up it to the Fraxel. I'm going really slow because when you're treating scars at the 1550, the depth has to be pretty deep, somewhere between 50 and 70 millijoules, which equates to 1 to 1.5 millimeters in depth, okay? Now on darker skin types, unfortunately, you can't do a high density, which is normally what we'd want to do to improve the scars really significantly in a single treatment. So we're doing lower density so we can treat her skin type, but a very high depth, okay? And what's nice about Fraxel is because it's non-ablative, meaning it doesn't burn the surface, it just goes deep. The risk of hyperpigmentation is actually pretty low at a low density on her skin type. But we just gotta go nice and gentle, nice and slow, and see that we can get improvement. Now, any hyperpigmentation should be treated with a hydroquinone, a retinol, a kojic acid, and a glycolic cream. Obviously, sun protection, you're doing really well. 2 more passes. And you can see with the 1550, a lot of swelling ensues. Okay. But I love this patient. She's a good patient of ours. I want her to get an amazing result. So we're going to combine this with the Enlighten Peel in a couple treatments, and you're going to see a very big improvement. I can already tell. 1 more pass, and then I'll show you guys what I mean by fractional. And if anyone's saying anything, feel free to tell me. Fractional means that only a small percentage of the surface is treated at once because the density is pretty low. So if you take a look up close at the edges, you see the little dots that are there. You see those little baby dots. Those are just the small microthermal zone columns that are heating under the surface because the entire surface is not treated, only a small percentage. Now let's switch the ice pack so you can cool over there, okay? Hold right there. Hold to the left now. We've been pre-cooling. I think that pre-cooling helps. Pre-cooling helps prevent any risk of hyperpigmentation or burn. And why am I doing such a large area on her? I'm doing it to blend. We want to make sure we blend the area. I know she only has scars in a small area here, but we're still trying to get this to blend and look even with her overall skin everywhere. Okay, single pass, you don't notice so much. You can just see very small microscopic thermal zones. But if we do a couple more passes, we're doing really good. We're almost there. We'll do a few more passes. What were you saying?
Val said Dr. Emer is the king of lasers.
Thank you. That's what I love to be known for. I appreciate it. You can see more dots. Take a look. Building up. You see the little dots kind of building because that's more density being treated. So now we're overlapping. She's doing really fantastic.
How long is Delta?
Just depends. For this case, I would say 3 to 5 days of some redness and swelling. But she's going to have her skin type's darker, so a lot of people won't notice it so much. Almost there. We're doing 4 vertical horizontal passes to really blend the area. There's our number 3. 1 more pass. Then what we're going to do is spot treat. Great. Now my patient was concerned not only about hyperpigmentation, but also orange peel skin, because she's read about this online. If this is done properly, the skin texture should improve. You should get collagen production, and you shouldn't get an irregular texture. That's when skin gets burned, okay? Hold this, let me take this from you. Switch back to the other side, hold that right there. Take a look now. Now you can see the underlying swelling. You see that? The edge of everywhere we've lasered. So now what we're gonna do is spot treat. We're gonna go back and forth over the areas of her scars. Because the energy is so deep, she's getting a lot of tissue swelling. Completely normal. We call that laser urticaria. Okay? That's just swelling, like a hive reaction. Yeah?
Why don't you make the energy higher for spot treatment?
Why don't I what?
Why don't you increase the energy for spot treatment?
Who's asking me that? You? Or I thought they were. I thought that you had that from online. That's a good question. Hold right here now. Because so the question was, why don't you increase the energy for spot treatment? You could, but this laser goes very deep already. And because we've already done a global area, we don't need to go any deeper over there. We just need the density to increase. So we're doing more passes over that area. If she was lighter skin tone, we can increase the energy. But because she's not, we want to focus on density. Energy means depth, and density means skin type. That's how you can remember. The more dense, the more painful, and the lighter skin tone you need to be. The energy is already at our max in depth. So we're just increasing that density. I want these to blend a lot more together. So I'm suspecting about 2 treatments of this with a peel in between, which is what we talked about, her and I. Which is great. She's doing great, basically done.
Why not peel before?
We could have. She's going on a vacation, right? Aren't you going somewhere?
Yes,
Yeah.
yeah.
That was our plan. Okay, perfect. That's it. So I'm going to have her ice both sides, and then our staff will give her this after the icing, and that's it. And we ice because we want to decrease. Let me give you that back. We want to decrease the swelling immediately. How painful was it? Are you okay?
No, it wasn't bad.
Wasn't too bad.
Yeah.
So in general though, as we increase the density, so if she was a lighter skin tone and I went to a very high density of 40, 50, 60%, she would feel a lot more pain. At lower than 20% or so, it's not as much pain, but you can still see, pull this off just for 1 second, all the swelling in there, okay, to the area. So we did a perfect cheek treatment and then overlapping pulses. We're gonna do that one more time in the next couple months in between with a lightening peel, where she get a really good outcome. So it's Fraxel for acne scars in a darker skin patient.